Hi, I'm Jordan.
Hello.
I'm going to be your student PTA today.
Hey.
I see you brought your son. Hi, nice to meet you. I know your son's not going to be here for a lot of your sessions, so I'm going to talk to you, and then if you need to clarify anything, we'll go to your son.
Okay.
First and last name?
Carlos Garcia.
Birthday?
July 9th.
Awesome. So I see that you're in here because you're still having low back pain.
Yes.
And it's starting to go into your right leg.
Yes.
Still a little bit of weakness.
Yes.
Is your pain still high? I see it was like a 6 out of 10.
Yes.
Still around there or higher?
Yes. 6 usually.
6 usually, okay. Do you have any other complaints or concerns other than getting back to work, supporting your families, just kind of getting back to that prior level of function before you had this procedure?
No. Maybe a little bit more on diabetes.
Okay.
Yeah. How that would,
So,
go with that.
I'm glad your doctor talked to you about your diabetes. So I see that you do have a past medical history of that, as well as hypertension, stroke, and heart disease running in the family. So what we're going to do today are a lot more strengthening exercises and to increase your movements. So our next session, we're going to go over some of those procedures a little bit more as far as foot care. And at the end of our session, I'm going to go ahead and give you a home exercise program. I'll give you some things to do with your feet because of the calluses that are forming, just so that we don't have any kind of ulcer form. Your doctor's told you about the ability to form ulcers. Okay, great. So are you okay with me touching you? I'm going to have to perform a few tests. And I might need to touch your legs.
Yes.
Yes? Okay, great. So, your right leg, I'm going to have you lay down and we're going to test the length of your right leg. So, head will go this way, leg will go this way. Awesome. Take your knees and go ahead and bend them to your chest. Both. Nice job. And then you're going to hug your knees. Give yourself a little stretch. Yep. I'm going to apply a little bit of a stretch. And then you're going to do one more time all by yourself. Nice. So what we're doing here is just a little bit of pressure, a little bit of release, so that when I ask you to go ahead and drop your arms, we keep your legs. This leg is going to straighten up to the ceiling. So just show me straightening this leg up to the ceiling. Perfect. Keep it there. Nice job. Bring it back down. Go ahead and plant your feet. Keep your knees bent. I am going to go get a goniometer to measure and see the degrees and if they've increased.
Okay.
Alright, so this is a fun little tool that we use. And it's like a protractor for your joints. And I saw on your chart last that your right leg was about 48 and your left leg was about 55 degrees. Now, those numbers may not mean a lot to you, but typically we see about 65 degrees. So we're going to work to get toward that within the next 2 weeks. So you're going to do that on both legs. So bring your knees back to your chest. You're going to keep your left knee inside, and then your right knee, go ahead and straighten your right leg. Awesome. So we're at about 52. It's about a 5-degree increase. That's really nice on the right leg. Go ahead and bend that down. Why don't you plant your feet while I walk around? All right, same thing on the left side. So knees come to your chest. Straighten your left leg. Good. 5 degrees here too. So we're at a 60. Go ahead and bring it down. How was your pain with that?
Wasn't bad.
Cool. We are going to do another, actually, I'm going to do another test, and then we're going to do some exercises, okay? So why don't you roll over onto your stomach. And I'm going to test the extensors of this muscle. So extension, you know, the difference between extension where you're reaching back and it gets nice and long. So I'm going to see how strong those muscles are. So the first thing I want to see with this, actually let's do it with the left leg first. So just lift your heel to the ceiling, lift your left leg off. Good job, bring it back down. Let me see you do it on the right side. Nice, bring it back down. All right, so the next time you're gonna lift it up like that and I'm gonna resist down. Try to not let me resist you down. Be as strong as you can, okay?
Okay.
All right, lift it up. And don't let me resist, don't let me resist, don't let me resist. Good job, let me go down. All right, so that's increasing a little bit. How did that feel?
Okay.
Okay, awesome. I'm gonna have you go ahead and roll. Actually, you're gonna push up and just come to a seated position on the bed, or you can even sit on your knees. The next thing we're gonna do are some exercises. Those looked really good. The therapist will be really pleased. We are gonna do what is called quadruped. So you're going to be on all fours. It's kind of like a tabletop position. I don't know if you've ever played a horsey game with any of your kids. Can you show me that?
Sure.
You can do it on the back. Perfect. Go ahead and walk your hands back just a little bit. There you go. Look forward. But you don't want to look too far forward, so bringing your gaze down slightly. Yep. And then start to, you feel where my hand is on your head? Think of that place reaching forward. Yeah, just like that. Good job. Then press down into your feet. Nice and strong. Glutes get nice and strong here too. Very nice. And you're going to just hold here forever. No, I'm just kidding. We're only holding for 15 seconds. All right, go ahead and relax.